presentation there, so you can let me know when it's time. Right. Good afternoon and welcome to UnitedTV. My name is Erkan. Today is October 3rd, 2025. So after 2 weeks break, we are back with our live sessions, and we have a lot of things to discuss. And one of our directors, our director in contracting, Anthony Anugu, is going to join me today. Before we get him in, we have a couple updates that I would like to actually start with those as soon as Ethan is ready. So one is recently we were at the Oracle Health conference, and this is mainly focused on AI in healthcare and interoperability. Recently, I just wrote an article that's posted on LinkedIn and other social media places, plus my blog as well. And understanding the access and empowering the patient, how important this is. And we wanted to make sure that patients and other people and other companies, other vendors, they do have a good understanding of what their responsibility is. And in this article specifically, I called one of our competitors, Epic, to come to their common senses, which would be getting the national cloud-based interoperability so that you can have access to your record anytime, anywhere. And this shouldn't be just like going back to 1967 and faxing things, trying to get things, trying to do, do stuff that we used to do 100 years ago. That should not be the case. So I was hoping that I would explain that article, explain this issue with this article, which actually has a real life example of it. So when we have emergencies, we just shut down. We don't actually function anymore, and then all of a sudden we are forgetting what access we have. And if I wasn't able to use my access that day, this person at the tennis club would have been gone long ago. So access is power, and then we need to make sure that everyone understands that. The second thing is the next week I'm going to attend International Law and Religion Symposium on behalf of my foundation, Marmara Group Foundation, and that's going to be next week, and it's going to be mainly discussing the religious rights to human rights and the religious freedom, and I will be representing Marmara Group Foundation. So after these updates, we can let Anthony in, and Anthony's studio has a little different setup now, so it's my first time on this setup. So hopefully your setup is okay on your side. So you're on. So how are you doing? Oh, we are live. Remember, we don't have any commercial break or anything. So
yeah, thank you for having me. It's good to be here again.
Well, it's good to have you. So there are two main issues that we want to make sure that we actually address. And at our provider meeting last night, we discussed the recent issues on the government shutdown. Now, as always, the optimistic part of me says, and I don't want to, make any of my politician friends upset, and I'm not going to say it, so that way I don't have to worry about them getting upset. So, but I think this will be resolved by Monday morning. The part
More
of the
optimistic than I am.
So the part of these live sessions helps me to have a good record of everything that I say, so then we can check the accuracy later on. But I think by Monday morning this will be resolved. In case though, if it doesn't, we have a lot of potential issues, especially in healthcare. So this is our day 2 on the government shutdown, and I think there's a pretty big tension. So you are someone who's following these very closely. I have some questions for you, and you may have some questions for me. I don't know if you do. So then we'll go from there. So the first is this fiscal policy or political leverage? This whole shutdown.
It's ultimately about people, people's lives. So it's I will approach it by saying that it's not a matter of whether it's political leverage or fiscal policy. It's ultimately about lives, people's lives. Now let's go back in the very beginning. The ACA, the Accountable Care Act, was passed initially with based on three legs. The three legs being subsidies, being the removal of the pre-existing conditions, and the insurance group, the trade-off with the insurance group was the mandate in order to allow the phasing out of pre-existing conditions. But eventually the mandate was removed as a result of legal challenges, and also he had the two legs. Now, it was also being sustained by subsidies, government subsidies. And the subsidies were quite narrow in the initial formulation of the Accountable Care Act. The Biden administration extended the premium tax credits by about 8.5%, generally speaking, which will be 400% of the federal poverty level. So that's how we got to where we are. But there were negotiations also in that process, especially with the then Democratic Senator Manchin, and that that tax, the subsidy was limited within a certain time frame. That time frame expires at the end of this year, 2025, right? So it was the Republican plan was always to phase it out, but the Democrats, on the other hand, are insisting that this needs to be extended. So that's where the impasse lies. But ultimately, it's about the lives of people, and the average premium in the standard, which will be the silver plan, will probably go up depending on a number of factors, depending on age, depending on where you are. It could go up as much as $851, right? It could also go up to as much as about $1,300, depending again on the age of the person, depending on the specific market you are in. It impacts especially the rural areas, right? Now, the ACA expansion is especially significant, and the level of enrollment is highest incidentally, in key Republican states, one of them being Texas. It's also in Florida and Tennessee, right? That's where you're getting the fastest growth in the Obamacare enrollment, and we have about 24 million people currently in it. Now, sometime early this year, a couple of insurance companies reported lower earnings in their quarterly reports. In their quarterly reports, it was, I think, Centene, and it was also Humana. One of the reasons is the concern that with increased ACA premiums, the healthier people in the exchange will leave, will exit, right? Leaving sicker people. Now, we are both in healthcare, and you know that if the insurance pool it comprises sicker people, the premiums go up. That's the bottom line. Without the subsidies, and at the same time, with exit of healthier people from the market, those premiums are going to become most likely unaffordable for the vast majority of people who are within certain income thresholds. That's why I say that it's not so much about leverage, it's not so much about the physical, but it's primarily about lives. Now, those other two issues, yes, certainly do come into play, but I would say that on the basis of a history, nobody ever really benefits from a government shutdown.
But yet we still find ourselves in these types of shutdowns.
Yes,
And when Democrats were in charge, same thing happened.
yes, because it's a contest, it's a political contest,
Right.
and everyone is seeking to gain advantages, political leverage. For the Democrats, in this instance, right, they're looking to use what is essentially a serious healthcare issue, right? But they're looking to use it to position themselves to gain in the midterm elections, right? That's a fact of the matter. Then on the other hand, on the Republican side, there's also an attempt to use it as a leverage in in the relationship with the opposition party, and you already can see that within the administration, there's an attempt to take advantage of the situation to get certain policy issues passed. But I should make the point that what makes this a little bit different is that the issues involved here, the core issue, which is the ACA premium tax credits, cuts across party lines. And that's where you see, that's why I think that if and when there is a resolution, it's likely going to be along the lines of perhaps extending this premium tax credit subsidies by a couple of maybe 1 year, maybe 2 years, sort of give everybody additional time and, if you like, pass the buck until further down the road because this impacts Republican senators in certain key states. It's in North Dakota, it's in Tennessee. So you can see there are Republican senators who are talking about, discussing the outlines of a limited extension, including the Senate Majority Leader John Thune, who's actually talked about it. But then, on the other hand, he's saying that first the shutdown needs to end, and then so that negotiations can stop, so rather can start. But then from the Democrat side, it says without the shutdown, we have no leverage to get anything passed.
So these are all interconnected,
Yes.
right? So you really cannot just try to cut the benefits and expect not to upset the healthcare industry. And in that, if we are trying to, you and I, we are not, but if everyone else is trying to see this as like, well, the Democrats are after the, blue collar, low income, and the Republicans are the other side. Well, when we cut the expenses, I mean the expenditures, then that means a lot of doctors, a lot of hospitals are going to lose their income.
Yeah.
So it's just one of those things that you can't really do it wrong.
Yes, it has domino effect.
Right.
You're absolutely right. It impacts on the physician side of it, the reimbursement will go down. On the hospital side of it, it also impacts the bottom line because you have increase in uncompensated care. Uncompensated care means that somebody has to pick up the bill. It's either through some form of government support or that the hospitals themselves swallow the cost of that.
It's not like the Medicaid patients who may lose their benefits are being seen by some Medicaid patient as a doctor.
Yeah.
So someone is gonna lose, and it's not just one party; it's everyone. So my, I wasn't gonna say it, but I can help. It helps me when I just don't hold anything back. Then I have less stress and I can sleep better. So this is true for my family as well. So then they keep telling me that I need to maybe not say everything, but then I'm like, then I can't sleep. So I think part of me says that politicians enjoy this because now they have to solve this problem, and everyone's attention is right on this, and everyone from both parties are going to go back to their own people in their own state and then tell them how hard they work for us. And that's why I'm saying that this will be resolved by Monday morning.
Yeah, I'm a little less optimistic than that, but you're absolutely right in the sense that somebody some time ago said that politics is the art of compromise.
Mm-hmm.
Nobody ever really gets what what everything that they want, and when there's a shutdown of this nature, the first thing
Right.
to say is that this is a failure of politics
It is.
because both sides expected to reach an agreement based on each side giving up something in order to keep the system going, and the system is not at this point in time.
Absolutely. Now, um, we kind of covered this in different parts. So I did have a couple of questions, but we kind of talked about those. So I don't want to overlap those and repeat the same stuff that we already discussed. But healthcare side is one from the benefit and expenditure standpoint, but the other one is from what we have already adopted and adopted and utilized for a long time since COVID. Um, and this one of the issues for the healthcare providers and for again for the patients is the telemedicine. And our accountable care organization with our accredited diabetes center may be impacted by this the most. Why is because nutrition and dietitian sessions, 90% telemedicine. But the thing is, it's not just a convenience for providers, but this is the compliance and the convenience for the patients.
Yes.
So the nutrition, if you see that as like a therapy of the nutrition, so you like let's say if you need that, if your PCP sends you to our group, now you can have this in your office without taking 2-3 hours from your time, and then also chances of you keeping your appointment is going to be very high. And I'm extremely disappointed that telehealth waiver was part of this whole, shutdown. And then there's also some acute hospitals at home type of benefits are being impacted. So, what's the overall actual impact from the healthcare providers and from their services standpoint that you anticipate?
Well, the first thing to say that the telemedicine waiver, so one of the big positives coming out of everything that happened during the pandemic. And within our group, I was looking at the some of our reporting going back. At the height of the pandemic, we had um, close to 37% of telemedicine use for all appointments, right? And as time went on, those numbers started to decline as more people who came into the offices to see their physicians. But one aspect of this that continued to grow was on the mental health side of it, mental and behavioral health side of it. Those numbers have been consistently high. Within our group, it's used for our diabetes management self help program, and it's been very successful. We recently had an audit which we scaled through very successfully, and it's all driven by the flexibility inbuilt in telemedicine that allows our nutritionists to be able to see patients through telemedicine. It's unfortunate in a way because those waivers really should not have been cut up in the shutdown. The Congress had the opportunity to extend those waivers, and the MGMA and the National Association of ACOs repeatedly pushed for that to happen. And there is bipartisan agreement on the extension of those telemedicine and hospital at home waivers. But typically these things never happen until you get to the last minute. And then now we're past the last minute and we're in a shutdown. And the if there's any silver lining to it, it's, as I mentioned, the fact that there's a complete bipartisan agreement on the issue of use of telemedicine, and I expect that when we get past the issue of the shutdown, that this will be restored, and more than likely retroactively.
So, um, the one of the other issue, some of the providers, they're probably expecting some anticipating maybe some delays if this is not resolved by this weekend. Now, before I go to that, I want to make sure that people understand. So many people think that we are in the United States, it's just like commercial insurances and everyone has their own insurance. That is absolutely not true. Just an example from the state of Delaware, from our ACO patient base and payer mix standpoint, we are about 22% average Medicare, 28 to 30% Medicaid, meaning that between the Medicare and Medicaid programs, the state and federal, we are about 50%. The other 50% is commercial, and that also is those are the insurance companies who are doing business with the federal and the state, and the any
As well as
permanent
private companies.
right. So any permanent impact will have um, reimbursements, potential reimbursement issues. What's your take on that?
Well, that's where your optimism, I would say, comes in the sense that hopefully, by Monday or Tuesday, that even if we do not have an agreement, right, that an outline or a pathway to one is becomes evident. Because the longer it stays, obviously, the greater the challenge, especially for small independent providers, which dominates the healthcare market in the state of Delaware, continues to dominate the healthcare market in the state of Delaware. So it will have an impact if small providers are not able to get their claims paid as and when they expect that to. There, there will be a domino effect in that regard in terms of the ability to keep the offices open, pay staff,
Mhm.
and see patients. So these all cascade down the road. And the thing about
Mhm.
government shutdowns is that the effect is often phased. So there's an initial lag, right, and everything looks like um, like it's normal, but then it starts to kick in one after the other. So the longer this lasts, definitely the more likelihood of a negative impact that cuts across the entire healthcare space.
So one of the main issue with this shutdown with the healthcare that probably needs to bring everyone's attention into the same, and you from the contracting side have a really good understanding of this. The part the pharmaceutical side of our expenditure, which is more than the inpatient, more than the outpatient, more than the radiology,
It's growing at a faster rate
and
than
it's going much
yeah.
faster now. And just to kind of give you an example, some cancer medications, um, like a 2 month supply, could be about like $30,000. When you are able to get the same medication in Europe for $1,300, same medication, that actually is the root of the problem. Why does it have to be this expensive? Is what they should be really spending their time on.
Yes.
And giving credits to, uh, I think President Trump actually is really focusing on that more than anyone else right now.
Yes, he has an unusual approach to it, which from From my vantage point, I look at it with considerable interest, if you like, academic interest, to see, because in the past, these issues have been discussed about perhaps importation of drugs,
Hmm.
perhaps it's what led the Biden administration to set up the price negotiation. But nobody has ever directly pressured pharmaceutical companies in the manner in which Trump has, and I find it quite interesting, and I'm actually watching very actively to see whether he will succeed with this. I mean, in the pharma industry, the U.S. market is
Hmm.
seen as the ATM of the pharmaceutical industry. Drug prices are highest here, and they do not come close to what it costs to get equivalent medication in Europe. It does not, and that's the principle under which Trump is
Hmm.
operating, to match the prices as they exist in Europe here. A lot of challenges to that because legally there's not much of he doesn't have much tools legally to be able to enforce this
But
price.
that's what they're there for,
But
to make the law.
but he has the force of the office, and that's what he's actively using in terms of the pressure approach. It's interesting that I was looking at the announcement on the nominee for health secretary in the state of Delaware, uh, Christine Lincoln,
Hmm.
and one of the statements on the blog on her bio talked about articles that she'd written about drug prices and the similar to the most favored nation
Hmm.
status thing. And it struck me immediately that this might be an interesting opening for the new secretary in the state of Delaware in working with the Trump administration,
Hmm.
because no one has ever approached the issue of drug pricing from from the aspect of using the power of the presidency to put pressure. It's all about pressure, but
Right.
it's not.
The
It's not.
tension.
Yeah, it's not about legislation. It's not about. It's purely about pressure, and it will be very interesting to see if this is successful. Um, right now, he's had a deal now with Pfizer. I don't know if you're aware of it, but he's reached a deal with Pfizer on drug prices. Doesn't fundamentally change
Hmm.
a lot of things, but he moves things in a certain direction, right?
Right.
And he's creating what's called the Trump RX
Hmm.
portal, through which people
Right.
um, can get medication. So we'll have to
I,
watch
I
and see
expect
whether this is successful
I
or not.
expect good permanent changes. Again, without the optimism, you'll get into depression. So follow my guidance on this. So going into the local, coming back to state of Delaware, Governor Matt Meyer um is facing bipartisan backlashes after the county executive Marks Henry. He was with us this month, um, and the issue is when Matt Meyer was the Newcastle County executive. Uh, Deliberately, the property reassessment data was delayed. Excuse me. Now I know you and I we are a little bit different on the Matt Meyer issue, so you probably like him a little bit more than I like him. So he's kind of your guy in this case. Um, so this delay actually created a lot of issues for the residents. And John Carney, when he was here, he was extremely upset, not specifically with this issue, but the way that it was pushed out like last minute. And I felt like he was not ready for all these. and then going from governor to the mayor position. So he probably he could have anticipated that a little bit better or prep himself better, but then that data wasn't available, but it was there. So um, the our good friend Brian Townsend and Michael Smith from the Republican side. There are two Michael Smiths, so this is the Republican guy. Um, they both call this unacceptable, and you don't really see the Republicans and Democrats on the same side when we have these types of issues at the governor position. But Matt Meyer successfully creating a lot of maybe not new enemies, but he's maintaining his enemies. So he has position to actually make things better. But I personally believe that the direction he's going is wrong. But anyhow, so then there's this issue came up, and we want to kind of address this because we have between John Carney and Marcus Henry, we talk about this a lot, and then we want to bring this at everyone's attention. So, and I know you have some questions there, and then we can dive into that.
Yeah, the first thing that I have looking through the issues involved here. Well, first, is this a case of just administrative management, or
Well,
in the hearings recently, it's been suggested that perhaps this was the delay was aligning with the election cycle, right?
so it did, right? So it did align with the election cycle.
But then the Sussex County did release the data at the same time within that same October-November timeline.
So the 65% of the population lives in Newcastle County.
Yes, but
And the Newcastle County executive was running for the governor.
Yeah, but those are different counties, keep in mind.
Yes, but that's why I'm saying that. So the delay from Newcastle was able to impact 65% of the population. So, and if you get the Newcastle County, you get Delaware, right? So, in total, I mean, look at our patient population for Medicare. So it's 65%, and the 35 is between Kent and Sussex. So Sussex by itself is not enough, and also there's no conflict. And Newcastle County executive running for the governor and delaying the data because it would impact his election race in a negative way is, in my opinion, is a full interference with, or like I think interference with the election.
If you go back, looking at the margins involved, especially the primaries, because this is about the primaries, really, not the general election. This is a Democratic
It was
state.
November. Well, true, but he waited until November, and he could have done it in September, right?
So the implication is that it was used in a manner to favor in the primaries. But then, if you look at the margin of voting involved in the primaries, how much of an impact could this really
huge
set to make?
It's huge because Bethany, like I was her co-chair.
9,000.
But Anthony, I mean, I was Bethany Long's co-chair for her campaign. So, and a lot of difficulties, a lot of insults, lies we had to deal with. And knowing something else is happening like this, we could have used this. So this was available in early summer. And when you don't actually release it until November, you kind of secure your position. As you just said, if you get the primary in Delaware, Democrats don't need to fight on the general election.
Beyond the political implication, the suspicion of political implication, what impact does this have on residents, the delay in the release?
It has impact on people's decision making and how quickly they can actually act on it, a lot of people needed to appeal these assessments, reassessments, and also understand. And now, honestly, now it makes perfect sense. And I don't want John Connor to, you know, be upset with me, but I appreciate what he has done. He was pushing this, but I didn't know why he was just trying to educate everyone, and he used almost half of the session for this, and it was not on my agenda. And he said this is important for people to understand and learn and act. So when you cut that time shorter, now people were not able to. I didn't appeal mine, so maybe I need to. I don't know,
I
but
did. I
you
did,
did. And then
incidentally,
what was the
because I
result?
live in Kent County. So I,
So you had more time.
in fairness, I had more time.
So that's so your the question has the answer is in your own action. So you were able to do it because you were informed, and we expect any government offices, state or federal, inform us in a timely manner. So don't hold anything back from us if it's going to involve what we have to do. So they're not our parents. They are there to do things on our behalf. So that's kind of like sometimes they forget that. So if you are holding back the information from me, and then if we appoint these people with the elections to those positions, that's not their right to hide anything from us.
Now, this issue it's in court at the moment, and you have the special legislative session also currently ongoing. I think next session I think is on Tuesday of
Mm-hmm.
next week.
Next.
Um, now, one of the things that I think is not gotten as much, perhaps as much attention, although I believe Marcus Henry did raise it up on but the quality of the data that was used in the assessment by the company that was
Mm-hmm.
hired to do this, right? There, is, there is some indication it appears that the data that should have been all of the data should have been used in the
Mm-hmm.
assessment hasn't been, right? Is where does this leave us then? If there are question marks about the quality of the assessment, never mind the timing of the release of data itself.
Well, I mean, it wouldn't be the first time something would be reversed and redone if there are enough damage from the individual standpoint. But the problem is here is the trust. So if you do this time, what's the next time you're going to do? Is what I would be looking for. So like we have, like you were going to be here today, right? So I trust you to be here today. So and if you don't show up once or twice, the third time I'm going to not invite you. So that's the trust that's being kind of um, uh, kind of it's already gone. So now I'm going to be not trusting as much as possible. But then the next election, I will exercise my options in a different way. So this would be kind of like from the people's standpoint. I'm not just saying just for me. Now we want Delaware to do better, and in order for that to happen, the governor needs to do better. So like, there's no interest for me personally to expect Matt Meyer to fail, because if he fails, then Delaware is failing. We worked with this state, we worked with the Medicaid program, we worked with the society here with the community. So we want things to be done in the right way. So that's kind of like the main issue.
Should he appear at the special session to
He
speak
should,
on this?
if they are inviting him, and if he needs to be, then he should. If if he's innocent and if it's just an oversight, it would be easier. But if it's not, then uh, then he would have a problem. So, and remember, the lawmakers are the Senate and the House in the
Yes.
state level as well. So, you know, friend of mine, SPCA. So I'm the executive board member there. But apparently, we give him the award this year's at the annual gala. Now, I did not know that until the day of the event, and I learned that at the event. So they kind of, I think my people didn't want me to know that with the relationship that we have, which was wrong. So if he needed to be given that, it would be done that way. So here, I'm going to just say this in a way that just so people understand. John Carney got the same award last year. Same thing. Last year, he got it. This is a 5-hour event. John Carney was there for 4.5 hours. Okay, so 4.5 hours he was there. Didn't try to be the center of attention. He just came in, socialized, mingled with people, and got his award and stayed, had his dinner, and he was there 4.5 hours. So I wasn't there for I was late and left a little bit earlier probably. Matt Meyer came for 25 minutes for the same thing. He was not there in the beginning at all. He just showed up in the middle of the dinner, and then he got the whole credit from Nicole Poor's work that she has done with the animal cruelty issue. And then he left before the dinner was done. So, and then he was extremely loud when he was talking. We have the mic here, and he was yelling to the mic. And then he says, "My wife is on call. She couldn't make it." Well, your wife is an admin MD physician for the ER, so she cannot be on call. She may have a shift. Then in that case, you should be saying she's working. But when you say on call, that's like she's doing something more than what she should be doing. I just don't like those things. And the problem is it's so visible. Everyone is able to see it. So, I mean, I talked to so many people that night, and they had the same problem. So with him. So, but I'm still open-minded because the focus is Delaware. Focus is not him or her or this or that. The focus is Delaware. So if you do something right for Delaware, we are going to support. So that's our state updates. I know my people have some other updates for us, but one of the things before I forget is about what's happening. Although I work extremely close with our Democrat representatives, I give a lot of credit to Donald Trump for things that he has done so far in different parts of the administration that he's in charge of. And one of them is what's happening in Gaza. And, and in this past week, I was in Turkey, and I was I had a guest appearance at one of the national channels with Bengü Kantekin, and we discussed the trip, the visit that President Erdogan had, and the looking at things with the solution-oriented approach is important. And I think one of the things that President Trump brings in, and it's too late. I mean, too late, but still there's things to do, and he's trying to make peace, and it needs to be supported. And it's putting accountability and responsibility for those countries to help to make this happen, because it's not just something that you move something from one location and then things are done. There's a big tension there, and then each side can work with their own supporting countries, and it can actually have at least better resolution. But the other thing that I want to make sure that people also understand, and people can go back and watch the early on coverage that I have for Gaza issue. Netanyahu is not Israel. Netanyahu is 35% of Israel supporting him. This was 2 years ago. Today, maybe it's even less. He had a lot of opposition in his own country. So now what I see is with the even with the Republican podcasters, so they are emphasizing that Netanyahu is not Israel, and that's important because the issue is not with the religion or the Jewish community. The issue is with this politician who's using his power to secure his future, and people really need to separate those two things. And I am hoping that President Trump, with the help of the region in the Middle East, and especially with President Erdogan's support, this thing will have better updates in the next 2-3 weeks. Hoping that's the case. So, Ethan, how much time do we have? So let's. Do you want to do the Jimmy Kimmel? So that's a fun one. So then we are not. We have a better transition to the Bariatric Friday. So Anthony, I was talking to him earlier because we had some topics we were going to cover together, but not all of them. So some of them were kind of updates, and some of them are questions, answers. Some you are answering, some I'm answering. But this Jimmy Kimmel was Faith and Ethan. When we have our prep meetings, like, oh, we should also talk about this. I'm like, sure. Now, the issue, what I didn't know that, can I just say this so that we can cut it off if Anthony doesn't like this, but everyone thinks that everyone knows everyone, but unless you're on Twitter, you don't know some of these people. Now, we were in Orlando together at the Oracle Health, and when Charlie Kirk was shot, I told Susan the news. She's like, "Who's Charlie Kirk?" Now, I'm used to that with Susan because she also didn't know at some time in the past like who Britney Spears was, who Justin Timberlake was. So, yes, this is true. This is true, 100% true story. So, but then Charlie Kirk, when she didn't know this, and I actually used this in Turkey, like with people in Turkey, everyone thinks that the entire public knows about everything because they keep asking me these things. I'm like, well, we don't talk about this. This is not on our agenda. So, and you had some similar issue with Charlie Kirk. You were not familiar with him much.
I'd never seen him before.
Right.
I didn't
So,
know
and I
what he
can
looked
understand
like.
that because
I never until
you have to be in certain platforms.
until his death.
And we can agree or disagree. We can like him or not. We can like his opinions or not. No one should be shot or killed for their opinions. No one. Now, um, Jimmy Kimmel. I don't watch him. I used to in the old days when I used to watch TV, but I don't remember seeing one of his shows in the last 12, 13, 14 years. I know that he had bariatric surgery and he lost a lot of weight. See, Ethan just learned that now, and Anthony from his face. This is I'm giving you guys new information. That's why I kind of knew him in the past, but so apparently he covered this Charlie Kirk issue in a really disrespectful and incorrect way, and he lost his job. Now I think 2 days ago it's reinstated and he's back, but I think the whole issue about this cancel culture I believe, is terrible. So either side doesn't matter. So I think public should decide who should be canceled by watching or not watching people, by following or not following people. So and I was kind of surprised that his channel is not, far from his own opinion. So they're probably really close, but taking action just because the other side is upset, I didn't understand that. So and this happens, both parties are doing this, and then the thing is everyone is guilty, so no one from each side should be criticizing each other because both sides are doing this at the max level. So but it was, maybe it helped him to increase his um, ratings because now we are talking about him. I don't know. So there's a lot of things, but this cancel culture is definitely, we should cancel the cancel culture. So that's where how I would actually leave that with. And I know we have a different bariatrics Friday session today. So I want to make sure that Dr. Picard is not waiting too long. So we are going to wrap it up here and we'll be back next week. And next week we have our Lieutenant Governor going to join us. She's confirmed. And then we have Jessica Needles on the 17th. And Nicole Poor is going to be with us on October 31st. And there are so many others are about to be confirmed. So we'll have a lot of good updates in the future weeks. So until next week, stay united. Thank you.